Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Hi, I'm your Dr. Minal Chandra. I'm the co-founder and chief consultant at Epione Pain Management Center. So today I'll be talking about grades of osteoarthritis. So what is osteoarthritis? Osteoarthritis is something which is a degenerative condition because you are aging. So when you age, the cartilage which is present in between the joints, any joint, that will start degenerating. And of all these joints, the most common is the knee joint. Why? Because knee joint is a weight bearing joint. So the osteoarthritis of knee joint is a very common degenerative condition. And usually every human will go through this process of osteoarthritis. But you must have heard that sometimes a young patient, 45-50-year patient is getting pain, and sometimes you say that at a 80-year, 85-year patient is good enough to not have knee pain. So why there is this variation in osteoarthritis? Now I would explain that this osteoarthritis progresses from stage 1 to 2 to 3 and then 4. Now initially the most common symptom that you will see in stage 1 is there will be some pain in the calf, some crampy pain in the calf, and when you walk for a long distance your knee will start hurting you. So when these symptoms have started, then you assume that it is the initial stages of osteoarthritis. Now should you ignore this? No. Once the sign of osteoarthritis have started, you should never ignore this. Then you need to see how your symptoms are affecting your daily routine. Are you able to do your daily routine activities or not? And then you need to start lifestyle modifications. What modifications? If you're obese, try to reduce your weight. Try to do certain physical activity. Try to do exercises for your quadriceps muscles. Do not sit on the floor. Avoid using Indian toilets. Start using Western toilets. Avoid taking stairs. Now, it may progress to stage 2 over a period of 2 to 3 years. And when you progress to second stage, what are the symptoms? So now your symptoms will also aggravate in daily activities like walking for a small distance. When you try to get up, you find it very difficult. Then initial few steps will be very painful. You get scared of taking stairs. So these are the symptoms which usually patient will present in second stage of osteoarthritis. And this is again a crucial sign. Do not avoid it because then it progresses to stage 3 and 4 where you may have to go for surgery. So again, like I said, the lifestyle modifications which you should start early. If you have not started, make sure that you are starting now, and also make sure to go and visit a pain physician so that they can do certain scans, certain tests, and identify what is the damage and what is the next step to be done. When it progresses to stage 3, again it may take 2 to 3 years depending upon your daily activities. In stage 3, what happens is even a short distance of walk, like a 2-minute of walk, become painful. Then your joint movements are restricted. You're unable to fold your knee joints. Climbing stairs is like almost impossible for you, and sometimes you may also have night pain and your sleep may get disturbed. So you cannot ignore at this time. You need to definitely go get a X-ray done, get a ultrasound scan done. You see whether there is a fluid inside, because sometimes what happens when the cartilage has been damaged, the bones will start rubbing, and in this rubbing there will be water formation. So your pain may increase. So make sure if there is water, you need to get rid of that water, and you need to see that the joint movements are coming back, because if the joint movements are gone, it is very difficult to bring it back. And finally the stage 4, which will again take 2 to 3 years, and this is the stage where your joint has completely stuck. The movements are restricted. Getting up, walking for 1 minute is like a hell. You cannot walk, and then you also realize there is bending of the bones, and you have now started to droop down. And sometimes because of this, you will also start getting pain in the back. So this is stage 4 for you, and this is the time that now when you go to a doctor, they will ask you for surgery. So these are the stages of osteoarthritis. If you start taking care of your knee joint pain for the first time when your knee or body has shown you the symptom, you will definitely progress this into stage 4. So do not ignore it. In whatever stage it is, your knee pain can be treated. You don't need to suffer. Once your knee pain has started, make sure that you visit a pain physician. They do a scan for you, they understand the damage and give you a proper treatment. And the best treatment would be to opt for plasma therapy, because this works best in the natural way and do not give you any side effects and complications. So make sure, if you have any of these symptoms, do visit your doctor. Do not ignore the symptom, because in future you may avoid major surgeries. Take care of your health.